Well, summer is almost here and COVID-19 cases continue to decline, but the risks are still there, especially with a new virus variant found in the UK and India. Our medical contributor, Dr. Ogachika Alozi with Sunset ID Care, joins me now. Dr. Alozi, I know we've talked about variants in the past on the program, but this one seems to have a little bit of a teeth to it.
Yeah, this is a legitimate variant. This is one of those things that we do need to worry about. I think up front, people need to understand that the vaccines that we lean on, which are the Pfizer and the Moderna, are still able to protect you. If you can get vaccinated, get vaccinated. What we're seeing, however, in the United Kingdom especially, is that this Delta variant is more transmissible and putting unvaccinated people as well as people that are younger in the hospital.
So there's more risk involved with this Delta variant?
Absolutely, but the risk is to those that are unvaccinated. I think that really needs to be the focus here. If you look at the United Kingdom's data, the steep spike that they're seeing is in under 20s that are unvaccinated. And so we really have to do a better job going into the summer.
All right, let's talk a little bit about summertime here. The living is easy, but we still have the COVID-19 issue to deal with here. What are some of the suggestions you have to people to help keep them and their families safe as we go into the summer months?
Yeah, I think that's a great question. I think it's an important reminder that June is actually Men's Health Month. And so not just men, but women. This is a good time to take stock. Do you have diabetes? Do you have hypertension? Have you added a little bit of that COVID-30 that you want to reduce? I think this is a good time to really focus and enjoy the fact that we have one of the best weathers in Texas. Get out there, take a walk, run, swim, use those water parks that are out there. Find a primary care physician. I think it's really important to find somebody that can help you manage your health and improve your health. One of the best things that you can do for yourself these days.
I know a lot of people have hesitated going to the doctor during the pandemic, so now's a good time to kind of turn that around. And I hadn't heard the COVID-30 term. I remember the freshman 15 from college, but I hadn't heard the COVID-30. All right, so what are some of the other things? I mean, we have summer camps. We have, you know, baseball leagues for the kids. And of course, most younger kids have not had the opportunity to get vaccinated yet.
Absolutely. And again, this is where you have to modulate it or sort of take it gently. If you have a kid that's been in sports, my son has been in basketball since last fall, let them continue to be in sports. If you're wary, I do want to remind our community of this. I truly believe that we've hit herd immunity. Now, is it time to take a victory lap? Absolutely not. We still have to work on those communities that haven't gotten the vaccine or haven't wanted to get the vaccine. But we're at above 90% in the under 65s. We're at above 70% in above 12s. That, by definition, is herd immunity, plus those have already been infected. Get your kids out when you can. Outside is the best place to be, and don't be worried. I mean, I think we have a lot of anxiety from 2020. That will go away over time, and our numbers in this community are truthfully amazing.
ABC News medical contributor Dr. Ogachika Alozi from Sunset ID Care. As always, thanks for coming on, and we appreciate you giving us your time.
Thank you.